welcome everybody. I know some people are still trickling in, so keep jumping on, but I think we're going to get started. Welcome to another edition of our Fireside Chat. I'm Katie Steck, here with Elizabeth Dawson. We're from Copia Wealth Management Insurance Services and Copia Wealth Management Advisors, Inc. And we are so grateful to have Craig here with us to join us and talk about open enrollment. So I'm going to let Elizabeth introduce herself a little and let Craig introduce himself, and then we'll get started.
Well, I'm Elizabeth Dawson, and it's such a privilege and an honor to be here to talk to you today. And we're going to be kind of the interviewers, if you will, for Mr. Craig Gusson. He is a dear friend of mine for many, many years, and he is a specialist in the medical insurance world. And we're not going to just talk about medical insurance for the standpoint of that, but it's open enrollment time. Whether it's open enrollment for your company, or it's open enrollment for Covered California, or it's open enrollment possibly for Medicare for you out there as well, or Medicaid, or Medi-Cal, what we call it in California. So there's a lot of nuances, a lot of dates to follow. There's some things that you probably didn't know that you could do. So we're going to take this time to talk about that. But yes, Katie and I, we're kind of a duo, and we work together, and it's a pleasure to meet with every single person that we do get that privilege to work with. So we are virtual from our office, and I think Katie's at home, and we have Mr. Craig Gusson, and we can't thank you enough for being part of our Fireside Chat tonight.
Elizabeth, more than happy to. It's always good to see you. So it's been many years, and I always enjoy every time we get to do something like this. So
yes,
we get to talk about one of my favorite subjects.
One of your favorite subjects, the health insurance world. So tell us a little bit about your company and your background, Craig.
Okay. So I am the president and CEO of Ackman Gusson. We specialize in health insurance, life, disability, long-term care insurance. Most of our practice is the employee benefit side, and we help individuals, businesses, and people turning 65 make sure they have the best and right health insurance plan for what they need, either for themselves or their employees and their family.
Great. Katie, why don't we start with you?
Yeah, I just wanted to let all of our participants know, if you have any questions during this time, please put them in the chat. I'll make sure that our experts here take a minute to answer your questions tonight. But I know with open enrollment starting really soon, maybe we jump into Medicare and things to know as open enrollment opens, and what to think about if you're just signing up for the first time.
Medicare is one of my favorite subjects. It's amazing to think about this statistic, but 1,000 people a day turn 65 in California. So in the month of the month of October, we've already had 14,000 people in California turn 65. 10,000 a day turn 65 in the United States, just to give you an idea how big we are. If you're turning 65 in the next year or two, what you want to do is you want to know that you can sign up for Medicare 3 months before your birthday, the month of your birthday, or 3 months after. If you don't sign up in one of those time frames, then it isn't guaranteed issue that you can go on it. So you definitely want to know. It's just, most clients start looking at it 3 months before their birthday. It will go into effect the first of the month of your birthday. So if your birthday is November, it'll go into effect the first day of November. The exception is if your birthday falls on November 1st, you would actually go on their plan October 1st. That's the only weird exception to it. With Medicare, you have Part A, which is free to anybody who works 10 years and paid into Social Security. It covers hospital expenses. Then you have Part B, which covers all medically necessary expenses, some preventative care. That cost this year $144.60. If you're collecting Social Security, they take it right out of your check. And that's going to go up a little bit next year. They've talked about $148, $153. So I'm not sure the number. We're waiting for them to announce it. Part A has a deductible of $1,408. Part B has a deductible of $198. Now, what does Medicare cover? It covers 80% of your expenses, but it does not cover prescriptions. So when people talk about, let's talk about Medicare for all, understand it sounds great, but Medicare does not cover prescriptions. It only covers 80% of your bills, and there is no limit. So if you have a $10 million bill, you could be on the hook for 20% of that. It's not like individual health insurance or group insurance where your max out of pocket could be $5,000 to $8,000. The nice part about Medicare is because you paid so much into it that you can now get this really good plan. And how do you cover the other 20%? Well, you have Part A and Part B, we just talked about. Then you have Part C, which is Medicare Advantage. Medicare Advantage is nice because you can say to me, hey, Craig, I use Scripps Network, or I use Sharp Network, or I use Kaiser. And then you can go and use that network of doctors and pay anything from nothing per month up to maybe $80 a month, and have like $5 copays, $150 to $250 a day if you're hospitalized for up to 7 days. And it includes prescription coverage. So what you want to do always is work with an agent to help you figure out if your prescriptions are on and everything else. The other option is a Medicare supplement. That is a plan where if you sign up for that, you can go to any doctor in the United States as long as he or she accepts Medicare. If they accept Medicare, you can go see them. So for a lot of my clients who are turning 65 and outside of COVID want to travel, they like that because they may pay, I love Plan G. It's pretty much covers 100% of everything except your Plan B deductible of $198. And it's like $117 a month. So you're paying that, you're paying $144.60 for your Medicare Part B. And then you get a prescription plan that can cost you anywhere from $15 to $75, $80 a month, depending on how many prescriptions you have.
Craig, that kind of leads me to a question because
Okay.
we were talking about this. I think that there's such an alphabet, that goes with Medicare and Medicare supplements, but you just mentioned something about the Medicare Advantage plan and the Medicare supplement.
Mm-hmm.
So what's really the difference? Because some people, they think that they know what they're doing, which I commend them for that, but maybe do they not know the options, or do they not have a good advisor telling them what's going on?
If they work with a Medicare agent, especially one who belongs to our National Association of Health Underwriters, they pretty much know the ins and outs. I've been on 2-day Zoom webinars within the last month talking about all the changes to Medicare, what could happen, things you need to know. Like people would say to me, I'm going to go on Cobra because I really like my plan. And when I come off Cobra, I'll go on Medicare. And I go, it doesn't work that way because you can't go from Cobra to Medicare after age 65 and get a guaranteed issue. It doesn't work that way. And it's not a qualifying event, so you could be penalized.
I think that's important to say because we're dealing in an environment right now where people maybe have lost their job and they don't necessarily know about health insurance and what their benefits are. They think about Cobra, they think they're going to be on it. But you said something to me before we got on camera that if they're on Cobra, they're eligible at 65, they haven't elected to do their Medicare, decisions yet, that could possibly be a non-triggering effect. And they wouldn't be able to go on Medicare? That's what you're saying?
They could, but they may have to go through underwriting because Medicare there's no health questions in Medicare. It's pretty much you give them your name, your birth date, social, and all the information they want, but there's no questions about your health history. So that's guaranteed to do it. So a lot of the clients, we talk to them about that. Like I have a client who got laid off and he was like 68 years old. He said, you know what, I'm done. And because he had work insurance, now we're going to move him over to Medicare. And he signed up for Part A and Part B, had some group insurance, and now he's just going to go on Medicare, and that was fine. We can do that. So most people I talk to, when you turn 65, you're normally better off going on Medicare than staying on your group plan. There's only one exception, and that is for somebody who's taking a lot of medications. I have somebody who calls me every year, has cancer, has thousands of dollars a month in prescriptions, and it's actually cheaper for him to pay $1,500 a month for his health insurance and not pay much for his prescriptions versus going on the Medicare plan because the prescription costs are so high. So that's one of the things that we need to analyze and make sure. And every year he calls me, and every year I say, "You still taking it?" He said, "Yes." And I said, "I appreciate your business, but there's nothing I can do to help you because you're not going to benefit from it at all." So outside of that unique situation, Medicare is a it's a fantastic plan. And it's one of the nice parts of turning 65 is that you benefit from that. But the reason is because you paid into Medicare all these years. Now you're finally getting something back out of it. And the plans are really good. And it's going to be there. People say, "Oh, Medicare is going to be gone." It's not going anywhere. Every 5 to 8 years, I have this conversation about, "Oh, Medicare is ending." It's not ending. But we just need to make sure that the people understand it. And when I meet with people, they're going, "How do you know this?" And it's like, I'm doing this every day. You and I talked before we came on about, doing some construction at my house. Well, I don't know anything about construction. To me, everything they're doing is foreign. But these guys do it every day. So they know how to do all the different things that I have no idea about and wouldn't even try. Medicare is the same way. We're doing this every day. We're dealing with it. We know exactly what you need to know, what works, what doesn't, what happens if this happens or that happens. Mm-hmm. And the nice part about me being so active in our association is that I have other agents that are Medicare specialists that I can go to and say, "Hey, I got this unique situation. Have you ever run into it?" I had somebody call me yesterday and ask me that. Very unique situation I've never heard of. And I said, I don't have the answer, but I know 2 people who will. So no matter what we're going to throw to us, we at least have somebody to fall back on. The biggest key is every year at open enrollment, you want to check your prescriptions. Make sure that your prescriptions that you're taking or that you may be taking in 2021 still work for the plan you have. Mm-hmm. On the Medicare Advantage plans and also on the Medicare supplement when you get the Part D prescription plan. So that's one of the things.
Can I ask you a question about that? Because there are so many options. So what option is what? I mean, we've got A, we've got B, but it goes C, D, F, G, K, L, M, N. Oh my gosh. How would we even know what to choose? How would the average person know what to choose? Because they think it's like A, I've got it, B, I've got it. But I mean, we talked about my father. He never had a health issue. And a little over a year ago, he got a heart condition, needed a lot of different medication. The medication was extremely expensive. Mm-hmm. We had to wait until open enrollment to get him on a health, on a health plan or, a prescription drug plan that was much more coverage.
Right.
Still had something to pay out of pocket, but the coverage was much more. But it took like a year of very, very expensive premiums. That's a big consequence.
So what you want to know is Part A covers hospital, Part B pretty much covers everything else. Part D is drugs. Part C is one of the 2 ways that you can supplement the Medicare. Pretty much Part C takes over the Part A and B and puts it all together with prescriptions. Which is best? Sit down with a Medicare agent and let them walk you through it. By the way, it is illegal for anybody to say, "I will look at your Medicare, help you with your Medicare, but I'm going to charge you a fee." CMS for Medicare Advantage plans dictate how much we can get paid, and we get paid by the insurance companies. So like the doctors in the hospital, that's how we get paid. It would never, ever cost you a penny to sit down with a health insurance agent if you use them or not. And if someone comes to you and says, "I charge a fee of $80 to meet with you," please call me. I actually had that happen last year. And we reported that person because it's illegal to do it, and they shouldn't be taking advantage of people who are 65 or older.
Well, I think that's an important part because it is talking to a specialist and someone that is a specialist as an advisor when it comes to Medicare. I mean, Katie and I are licensed in that world. We don't even touch it. That's why we have you in our lives, and that's why we refer those types of clients to you. Exactly. Just because we need that relationship with someone focusing on it all the time. But again, it is so confusing. So I think a lot of times that people think once they're actually on Medicare that they can't change their plan. So is that true or not true? Can they bring
you can change your plan. Medicare open enrollment right now is for prescriptions, and that's October 15th to December 7th for prescriptions and for Medicare Advantage. There was a book called, if you can see it,
Can't see it. It's kind of fading out.
Yeah, okay.
What's it called?
It's
What's it called?
Medicare and You
Medicare
20, Medicare and You 2021. Anybody
Okay.
who's on Medicare or gonna go on Medicare this year is gonna get that book. That's pretty much the Bible. Everything you want is in there. You go to Medicare.gov, they will give you all the information you want. That's the best way to protect yourself. And just talk to an agent who specializes in Medicare. And again, if you need, how do you find an agent? You can go to sdahu.org and you can look up find an agent. And we have agents all over the country. So you can go to nahu.org, which is our national association, and they will also, it's on the very bottom of the first page, it would say find an agent. You can just go in there, click, put in your zip code, what you're looking for, and you can find an agent that's probably within 5 minutes of your house. So
We
it's
talked about this
really
other part a couple days ago, because sometimes people think that when they have Medicare that they have long-term care benefits.
You know, that's probably the one thing I always laugh about, because a lot of people think that and they don't. Long-term care insurance and Medicare are totally separate. There is no coverage. What people do is they read, what, if I'm in a hospital, I'm going to have like 5 or 6 days or a certain amount of days of some coverage, and they think that's long-term care. It isn't. They're totally separate. So buying long-term care insurance is the other shoe that you need to get to protect yourself, so that if you're in a assisted living facility or something like that, because again, long-term care is expensive. I mean, being in a facility is expensive. You're looking at $4,000, $5,000, $10,000 a month to cover, you know, a monthly expense of being in Medicare. So, you know, my mom's in a assisted living, and it's over, you know, it's, even though she's independent, it's over $4,000 a month.
Wow.
And she doesn't need a lot, so we're really lucky. But my mother-in-law was over $5,000 a month because she needed a lot more. Neither one had Medicare. I mean, I'm sorry, had long-term care. So it's really important that that is something to really consider as you're getting into your 50s and 60s, as a way of protecting yourself, so that you're not wiping out and having to sell your house, do reverse mortgage or something to help pay for those bills.
Well, and even though the cost of long-term care insurance might seem expensive, it really isn't in consideration if you're living in a long-term care facility for more than 3 to 5 to 10 years, paying, you know, like in Craig's situation, $4,000 to $5,000 to $10,000 a month. I mean, this is unbelievable. I think everyone on the planet at this point has been touched by that experience where people have had to have care, and who ends up paying for it? Usually a family member. So
it ends up being a family member or the kid's inheritance, you know. And my mother-in-law decided that she liked it, and she was in assisted living for, I think it was either 12 or 13 years, where the average person is 2.7. So, you know, it does get really expensive, and it's just something to be aware of.
Well, Katie, I'll just kind of pick on you for a second there. You know, just imagine if your mom didn't have long-term care, do you have enough money saved to help pay for a facility for mom?
No, and my grandparents were that 12 years. My husband's family, 12 grandparents, 12 years in assisted living. So I don't.
This is part of the conversation. Yeah, part of the conversation is, don't think that Medicare provides for long-term care. We need to kind of, you know, remember that when we're doing our planning, because even Medicare planning is part of the whole financial planning process. And that's what's so important, because if you don't have the financial bucket of money put aside for those events in your life, you are not going to be covered, and it will deplete your estate or potentially family members a burden. So I'm glad that you answered that, Craig. Katie, do you want to ask a couple questions to Craig about Medicare at this point, about open enrollment?
Yeah, I know you mentioned the prescription and the Part C dates coming up. Are there any other important dates to note in the next couple months?
Yes. If you pick a Medicare Advantage plan, which is Part C, and then in January, February, you find out, you know what, I don't really like this, or my doctor is in a network, you have between January 1st and the end of March to change your Medicare Advantage plan. If you don't do it by the end of March, you can't change it until next open enrollment, which will be next January.
I think that's really good to know.
That's actually good to know, you know, that there's even, you didn't just make the decision and can't change it.
And there's a birthday rule if you have a Medicare supplement, which means the month of your birthday, you can change from one plan to another. Understand the biggest part of this. You can always go from a Medicare supplement to a Medicare Advantage. You cannot go from Medicare Advantage guaranteed issue to Medicare supplement. So we recommend to our clients that if you like the opportunity of being able to have a plan and going any way you want, get that. But those rates are going to go up as you get older. So maybe when you're 75, 80, you start thinking, okay, I'm not going to be traveling as much, and maybe I'll get a Medicare Advantage plan. My mom pays $25 a month for Medicare Advantage, and she's in her 90s. Whereas if she had a Medicare supplement plan, you're probably looking at $700, $800 a month, even more than that. I don't even know because I've never had anybody stay on it that long because it really gets expensive. So again, it's what you talk about, Elizabeth. It's planning. You know, you might go with the Medicare supplement now because you hope to be traveling. And then when you get to a point where you're going, okay, I'm not traveling as much. Again, in an emergency, all the plans will cover you. But in a non-emergency, if you want to go to New York and see the specialist, you can do it with a Medicare supplement as long as he or she takes Medicare, which most of the doctors do. You know, probably, I don't know, I'm guessing, I don't know what the statistics are, but I'm guessing 80, 90% of all the doctors I've ever met take Medicare.
More questions, Katie?
I guess, so how do you determine which supplement plan is right for you if you are maybe 66, 67, you still have an active life, no major health issues, but not sure what might happen?
There's plan, like Elizabeth said, there's plan A to N. I love plan G because pretty much it covers 100% of everything except for the $198 Part B deductible. It covers doctor visits, inpatient, outpatient surgery. You walk in and go, do whatever you want to me. I don't care. And the only thing you're going to walk out paying is maybe $198. So for a lot of my clients, they like that because they've been used to having a plan where they can go to any doctor they want and they're paying $700, $800 a month by the time they're in their 60s. And now they're going to go down to maybe $300 a month, including Part B. And they're going, hey, this is great. And I don't have a copay for doctor visits. I don't have a deductible. You know, the only thing you're going to have is you're going to have a prescription plan with it and you're going to pay for prescriptions. But for the medical Part A and Part B, you're not going to have any expenses except the $198 deductible. Again, sit down with a Medicare agent, explain your situation, or in this world, maybe we're going to do it by Zoom or by phone, and talk about your situation. What are your concerns? You have a certain doctor you like? And if you say, well, some of my doctors are in the Scripps Network, some are in Sharp, I go to Alvarado, you don't want a Medicare Advantage plan because you're not going to find one that covers all of them. So I met with somebody via Zoom last week, and he said to me, I've been with Scripps for 20 years. So I only am going to see a Scripps doctor. It was a piece of cake. I said to him, I can get you a pretty good plan. It's going to cost you $0 to $25 a month. And he was ecstatic because he was paying a lot more than that up to this point. So again, we can look at your situation and help you analyze what's best for you. And oh, by the way, if you do better get a Medicare Advantage plan, and in the first year decide I don't like it, you can on your birthday or next year at this time, you can change to a Medicare supplement in the first year. So it is a one, you know, you do have that where you can test it and see if you really like it or not.
Well, it sounds like there's some flexibility, which it sounds good. That's a good thing. So I know we need to kind of travel into the other open enrollment, which we have Covered California that's open. We have open enrollment for a lot of company benefits. So what do you want to talk about here with Covered California, or the fact that if you don't have insurance in the state of California, which we thought it wasn't a fee, fine anymore, but California kept that fine. Why don't you talk about that?
Yeah. Okay. So first of all, California passed a law a couple of years ago that said, as the Trump administration took away the penalties, Covered California brought it back and said, if you do not have health insurance, you're going to be fined $600 or 2.5% of your income, whichever is higher.
Wow.
So if you figure that you're making, $30,000 a year even, that's $750. So, and you're still responsible for all your medical bills.
Mm.
Because some people say, well, that's a good deal because they're going to pay my medical bills. Oh, no, no, that doesn't work that way. So Cover California and all individual plans are going to have open enrollment starting in 2 weeks, November 1st. And it ends the last day of January. You can get a subsidy, which means the government in the state of California are going to help pay for your health insurance. If you're single, making more than $17,609, up to $50,000, you're going to get the government to help pay for it. If you're a family of four making $36,000 to $103,000, you're going to have the government help pay for your insurance. It's very important that because how much money you get in the subsidy depends on what your income bracket, where you end up making money. So if I got a family of four and they're saying we're going to be making like $5,000 a month, $60,000 a year,
Yeah.
we can get them. We might get them $1,000 a month in subsidy, which means whatever the premium is, the government's going to cover the first $1,000 of it. So maybe you're going to pay $800 a month for your whole family to get a really good plan. But if you end up making $80,000, you won't qualify for the $1,000. You might only qualify for $600, which means when you do your tax return the following year, the government's going to say, we gave you too much money and we're taking it back, either out of your rebate, refund, or you're going to get a letter from the IRS saying, oh, by the way, Elizabeth, you owe some money.
Well, I gave you a specific example because we have a client that told us this week that their medical premiums are under Covered California are going to be $1 per month. Now, this is a younger gal who's in her mid-40s, and she has a son, and she was an airline stewardess for many years and took the retirement package, which was not a monetary package. It was basically benefits for flying wherever she wanted to go, anytime she wanted to go for free for her and her family, which is a wonderful benefit, but there's no pension, there's no income, there's no nothing. And, this is a different situation, right? So if she took a bunch of money out of her IRA just to survive right now, we're saying that could have a major impact.
Yep, I've had that exact situation. And, I'm not making a lot of money. Well, I've actually had two situations. One is they were going to only make on paper $15,000. I said, well, you got to take out $3,000 from your pension to bring you up to 18 so you don't go into Medicaid. But I've had the other side where they say, well, I'm only making $30,000. And then we start talking about what other income you have coming in. Oh, I'm getting Social Security. I'm getting this pension plan. And now they're way above the subsidy numbers. And it's our job to educate them and say, it sounds great, but you need to understand that you're going to owe all that money back. And oh, by the way, if you work for a company and they offer health insurance, you don't qualify for a subsidy. And if you get it, you're going to end up giving it back because the government requires the companies to file a form with them. And it pretty much says that you offer health insurance. So you need to really be aware of that. Again, you want to work with a health insurance agent because we'll walk you through it and make sure, because the last thing I want to hear, and I get these calls all the time about, how come I owe all this money back? And I go, well, let's look at it. We recommend in June, look at how much money you've made so far and see if you're on track. So if you said I want to make 40,000 and in June you're only at 20, we're in pretty good shape. But if you're at 35, we need to readjust that, or at least say, hey, Elizabeth, you need to start putting some money away because you're probably going to owe that money back at the end of the year. You can either do it right now or we can do it at the end of the year, but you're going to owe this money back. Now, for people with COVID, we've had a lot of clients call me up and said, I'm getting laid off. What do I do? I said, how much money have you made this year? They give me that number. What do you think you're going to make between now and the end of the year? And this is the tough part because you're dealing with Elizabeth the same way I do. They don't know.
Yeah. And how does unemployment and the subsidy for unemployment, how does that affect? I would imagine.
Unemployment will be part of it. The extra money you're getting because of what the government's doing. All of that. So that is why it's so important to sit down and say, let's talk about what money you're actually getting and what's going to be counted and what may not be counted so that we can make sure that you're not going to get hurt, this February when you do your taxes and find out that you owe them thousands of dollars and you're going, I haven't worked all year. How can I owe that?
Wow. Yeah.
So it's really important that they understand all the rules of how to do this. And just when I think I got it totally figured out, Cover California changed the rules a little bit. So it's really important that you just understand it. And as we were talking before, if your income is less than $17,600, unbeknownst to you and me, they're going to, Medicaid or Medi-Cal in California is going to take you out of your plan to cover California, put you in a Medi-Cal. And how you're going to find out is when you go to the doctor and they go and they go, well, your plan's not showing up. And then we get the phone
Oh,
call
boy.
and we find out, well, how is that? And again, Medi-Cal makes a lot of mistakes. I had a husband and wife both making, they were both making like 30, 40,000 a year with the kids and all that. And Medi-Cal went and looked and said, oh, well, the family income was only 40,000, not 80. And because of that, they all qualify for Medi-Cal. It took us like 6 months to get it fixed, to explain that they really don't belong in there. So they make a lot of mistakes, and we end up spending months and months trying to unravel the nightmare. So be aware of that. The good news is the rate increases, the increases that we're seeing come effective January 1st were anywhere from a 1% to 2% rate decrease up to a 3 or 4% rate increase, depending on the plan. So we've been looking at some of the Sharp and Health Net plans that we sell, and we've seen some with, well, pretty much your rates aren't changing at all, or they've gone down a little bit. So it's really important to look at that. Also, it's really important, we're going to go back to what I mentioned a couple minutes ago. Medication. What medications are you taking?
Mm-hmm.
Are you a female and are you expecting to have a baby in 2021? Are you, a buddy of mine having hip surgery? So he wants a better plan than what he had prior to that, because you're either going to pay, pay it per month or pay it when you use it. And like one of my clients, she had twins, and she was a very thin, short girl. And she said to me, I know my kids are going to be in NICU. I know I'm going to have the baby early and all this. And we got her a rich plan. And because it was under a group plan, she was paying for it with pre-tax dollars. And she paid like $3,000 or $4,000 to have twins.
Wow.
So we want to plan ahead of time. Are you having a surgery? Are you, is there anything next year that you're thinking about that you may get done? And if you do, well, maybe the plan you have, you might want to change. And then the following year, maybe we move you back. Like my guy with the hip surgery, we got him a better plan for 2021, knowing in 2022, he's going to go back to the plan he had. So under individual plans, you have platinum, which is the richest, then gold, then silver, then bronze. You don't want a bronze plan because you get 3 doctor visits for $65 each. Everything else has a deductible of at least $6,000, and I mean everything. You get a 4th doctor visit, you pay 100% of it. So the bronze plan is for somebody who has a lot of money put away, or they might have a health savings account, which is like a medical IRA. So outside of those people, I don't recommend it. The most popular plan we sell is the silver plan. $45 doctor visits. X-ray and labs can be covered with no deductible. It might be a $30 to $50 copay for that. MRI, CAT scan, PET scan, maybe $300. But an inpatient, outpatient surgery, you're going to have your deductible of $3,000 or $4,000. Then you're going to pay 20, 30% until you pay $8,000 out of pocket. But for a lot of my clients, they go, look, I go to the doctor once or twice a year. And I said, okay, Katie, what are you worried about? Because usually someone about Katie's age, she's going, go to the doctor a couple of times, x-ray labs. And I go, if everything's 30 to 50 bucks, is that okay? Oh yeah, that's fine. Perfect. The silver plan's a great way of going. The gold plan, it's a nice plan. It's richer, usually no deductible. You're going to pay a little bit less for copay for doctor visits. Your maximum out of pocket is still going to be somewhere around $7,000, $8,000, but you're not going to have for an inpatient, outpatient surgery that $3,000, $4,000 deductible before anything kicks in. Again, the gold plan works for the right situation. Platinum is the rich plan. That's the one where there's no deductible. Your max out of pocket is $3,000, $4,000. You pay 10% of whatever the bill is. So if you got a $10,000 bill, you're paying what, $1,000 out of pocket. So, but again, it's a lot more expensive. So rarely do I see someone getting a bronze or a platinum. It's usually the silver. And if you want a little bit better coverage, you go to gold. So those are the two we're really seeing. And that's true if it's an individual plan or if you're getting it through your employer. If you're getting it through your employer, as you know, Elizabeth, is paying a portion of the premium. to get group insurance, the employer has to contribute X amount of dollars.
Mhm.
Normally, it's a minimum of $100 a month or one half the cost of a certain plan or the plan you pick. So the employer's giving you a benefit that you're not paying taxes on. You get to pay for your health insurance with pre-tax dollars. That means you're not paying tax on the money you contribute toward your health insurance. So it's a win for both of you. And again, what we're looking at for the group rates is we're seeing with Kaiser, some Blue Shield and Health Net and Sharp plans, a 1 to 2% rate decrease. And again, for other plans, we're seeing a 2 to 9% rate increase. A couple plans I've seen a 15 to 20% rate increase, but those people are pretty much going to be moved over. So the good news is this year, we're not seeing a lot of rate increases. And I'm not seeing our groups move as much from one plan to another like we've seen in past years. So I keep telling my wife, this is not going to be the crazy year that we've had over the last 4, 5, 6 years, because we're not seeing a lot of movement. And people are saying, you know, if rates are staying the same or going up a little bit, I'm just going to stay where I'm at. My employees are happy. I don't want to deal with it right now. Now, the other side, going back to COVID, is I have clients who own restaurants and bars. And one of my clients who owns a bar, we started talking and she said to me, here's my average employee makes. How much would it cost them if they went on Covered California? And it was the exact same premium that they were paying for their health insurance through the bar. So we ended up, she dropped the group health insurance. We put everybody in Covered California based on what we knew the income was going to be. And they're still spending the same amount of money, but we're protecting the bar owners so that they can continue keeping the bar somewhat open if they can, and keeping it in existence until they can start hiring people back. And like the bar owner said to me, no one's coming back to work full time. When they do come back, it's going to be on a limited basis. So we're trying to help the business owners as much as possible, because a lot of them are getting hurt and they keep waiting for, are we going to have another, outburst of the COVID? So whatever's out there, just know that if you get laid off or if you get furloughed, if you get laid off, then that means you're not getting any benefits from your job. If you're getting furloughed, that means you're still on your group health insurance. Those are the differences. And we can help those people. And we're working with a lot of business owners because they don't know what to do.
Yeah.
They're saying, I don't want to lay my people off, but I can't afford it because I have no money coming in or I have very little. So we work with them and try and find something that works for everybody.
It's
And
been
it's
a very
tough and-
scary year for many
It is.
business owners. It's been a very scary year. And it's amazing to me that health insurance premiums haven't gone up, because I think this is the year that everyone is that much more, conscious of their health. And with the, the increased costs for vaccination and everything else that's not even here yet, I would think that those costs would be going up. But I
The reason
imagine
I'm
that
laughing,
there's some,
the reason I'm laughing,
yeah,
the reason it hasn't gone up, how many people that are on here have gone to the doctor this year? Not many.
yeah.
Next year.
Mhm.
However, what I am seeing is this. A lot of the insurance companies are required by law, if they spend less than 85%, 80 to 85% of their money on health insurance, they got to give it back in form of rebate.
Wow.
So today I saw with Blue Shield that they're pretty much, I'm not sure if it's individual or group, but they're giving a waiver of paying your premium for the month because they don't want to take the hit at the end of the year. They're doing it now for tax purposes. So the concern I have right now is exactly what you just said, Elizabeth, except next year, what are the rates going to look like? Because all these people are putting off surgeries. And I had clients of mine going, my guy who was going to have hip surgery this year is having it next year because he's not real excited about with COVID going into the hospital. So he said, you know what, I'll put it off to next year. So our concern, really what we're reading about and hearing about, is what is it going to look like next year?
Yeah.
One of the big concerns that I have that everybody should be aware of is two of them. One is ambulances. Most ambulances don't take anybody's health insurance. So please be aware of that. And, work with the ambulance and the insurance and work with your agent. The other thing is prescription.
So I want to back up to that. So how does that
Okay.
work? If you have to have an ambulance, you're calling 911 and they don't cover your health insurance, that's out of pocket?
What happens is most of the ambulances, you'd watch any TV station and you'd see what happens. There's an accident, ambulance shows up, take them to the hospital. Well, most of the ambulances don't take most of the insurances. So I have clients call me up going, I get this $5,000, $6,000, $10,000 ambulance bill.
Wow.
The insurance company says we're only paying a portion of it. So we've been having a discussion with Sacramento. I've been having one with them for at least 10 years. The air ambulance finally gave in. And you know why they gave in? Because Medicare was going to pay them less money. So they agreed to take what the insurance company paid them so that Medicare wouldn't reduce what they get paid. We need to work with legislators to get Sacramento, and Washington, D.C. is also working at it. Surprise billing. I know you've heard of that, Elizabeth,
Yes.
and a lot of people have. You go and you say, okay, my max out of pocket's $8,000 for a year, and all of a sudden you find out that in the hospital, the anesthesiologist, the ER doctor, the radiologist are not W-2 employees.
They don't all take your insurance. Yeah.
They don't take your insurance, so all of a sudden you're sitting with a $10,000, $15,000 bill. It's not fair to them. And every year when I'm in Sacramento or Washington, D.C., I'm talking to a congressional member saying, you need to fix this because it's not fair to the consumer. They have no idea. They're laying in the middle of the street, the ambulance picks them up, takes them to the hospital, and everybody who's touched them is not in their network, even though the hospital is. It's just not fair.
Wow.
You know, imagine if
So
I
what
came to
can
see
someone do? What can someone do about that?
you. Reach out to your Congress women and men and your legislators in Sacramento and just tell them you need to change this. Anybody running for office is going to listen to you right now. There's elections in 3 weeks. They want to get, they want you to hire them to do their job. The other thing that's really important is when I go to get a prescription filled, I rarely ever use my health insurance card. I walk into Vons, Costco, or Walmart. I say, here's my prescription, I'm paying cash. And usually I can get a prescription for anywhere from $4 to $6 to $8. You can go online to Walmart, Vons, Costco, and you can type in your prescription or your condition, and you can find out exactly what a 30-day supply of that prescription costs. So one of my doctors once said to me, you know, if I double your dosage and you want to get a pill cutter and cut this pill in half, you could do that. So instead of getting a 90-day supply, I got 180, and I think I paid like 15, 20 bucks. And I thought, this is a great deal. So I always try and get my clients to understand, I want you to be smart consumers. So don't walk in and say, here's my prescription, here's my copay, $15. Because I'm gonna be behind you going, here's my prescription, and I'm paying cash, and now maybe that costs $4. The nice part about though, is a year ago or so, they passed a law that said pharmacists are now allowed to say to you, by the way, if you pay cash, it's less. They couldn't do that prior to, I think it was last October. So the nice part is that you're starting to hear that more and more. But even if you have Kaiser, I had Kaiser for a year. And when I did, I said, just give me the prescription. I'm going to go to Vons, which is around the corner from where I live, and I'm going to get it filled. And he asked me why, and I explained it to him, and he had no idea. So again, if you have a high deductible plan, you're getting a colonoscopy, you can probably get it cheaper than if you went through your insurance just by calling around and seeing who does it and paying cash. So think about the plan you have and what it covers and what it doesn't cover. Be a smart consumer. It's what you teach your clients every day, Elizabeth, you know, how to save your money and protect yourself. And that's really what we do. And again, work with an agent. We get paid from the insurance companies like the doctors and hospitals do. We're there to help you. And we're there every day of the year for you. So when a client calls me up and says, and I get this once a quarter, I got this bill and they're not paying any of it. I say, tell me what the bottom left corner says, who the insurance is. There isn't a name. I said, well, they either lost your ID card for your insurance or they somehow never got it. So call them up and tell them you have Sharp, Blue Shield, HealthNet, Kaiser has their own. So
That happens quite often.
it does. So we do that. And then, you know, I'm dealing with it right now. They go, you owe this money. I go, no, I don't. So, and it's, you know why? Because we're human. It was lost. We get it fixed.
Yeah.
And a lot of times it's just doing that. Just don't pay the bill. You know, I always tell my clients, when you get the first bill, I don't even pay it. I just throw it away because it's going to take them 3 bills to even get the insurance to rectify exactly how much they were going to pay before you owe it. And a lot of my clients would just email me the bill and say, do I really owe this? And I start looking, I go, yeah, the numbers look right. Or I don't see who your insurance is on here. Like we had one a couple weeks ago, they had his insurance that he had 2 years ago. on it and not the one he had today. So I said, do me a favor, just send him a copy of your new prescription card and they will get that rectified. So those are the things that we as agents do all year long. And even for the Medicare agent, it's not like we're working 3 months a year. Because again, 1,000 people a day are turning 65. So
Right.
we're busy all year long helping people with the prescriptions and with the Medicare and with all their insurances to help them. And, I have a staff, as you know, Elizabeth, and that's what they do. They help me take care of all the behind the scenes stuff, the same way your office does, so that the clients are taken care of and they're not caught in the middle of this going, what do I do? I don't understand this. And Medicare is the number one thing. People say to me, I thought I'm pretty smart, but I don't get this. And then they get.
I don't think anybody gets that, Craig. And then
No.
I'm gonna
Yeah.
pause here because we're
Okay.
getting close to the end of our hour.
Okay.
I know Katie has some questions. I'm sure she has some questions from
Yes.
our audience. And let's see if we can answer a couple of those.
Let's go.
I have one big question I know comes up a lot, and especially the people who I know are on here, is if you use a chiropractor a lot, and whether you're on Cover California or independent insurance, are there any good options to have that covered by insurance or helped with by insurance?
On your Cover California policy, it sometimes has chiropractic coverage. I haven't found a chiropractor yet that takes it. So for group insurance,
Wow.
We can get you a chiropractic/acupuncture benefit package that we can put together for the owner of the business. It isn't really that expensive. But honestly, if the chiropractor is charging $40, $50, it's a lot cheaper than me trying to find something for you. But for individuals, no, I get that asked a lot. And unfortunately, even Kaiser says, they have chiropractic, and people go, really? I go, you got to find it. And I don't know any that do.
Oh.
But speaking of that, I get a lot of questions about vision. Elizabeth and I are wearing glasses. So if you have a Kaiser plan or you have an HMO plan, you can go to your ophthalmologist, pay your copay, and get your eyes checked. Or you can go to a Costco or an optometrist and get it done too. So that's one thing. The other is dental. I'm not a big fan of dental for an individual. You're going to pay $40 a month, $480 a year, and you're going to get $1,000 worth of coverage. And oh, by the way, they don't cover crowns and all the major stuff for a year. So you're going to be into it for $1,000 before they start paying anything. Don't waste your money. If your employer offers it, yes, at that point, it may be a pretty good idea to get it, especially if your doctor's in network. We have a discounted dental plan that we use a lot, but honestly, that we can get is like $100 a year. But I can tell you, if you go to a dentist and say, Doc, I'm paying cash, you will get a discount. My wife called me one day and said, I'm at the dentist office. Our son needed to get wisdom teeth out, and it was $1,300. And I said, how much is it if I write a check? And he said, it's $1,000. I said, we'll write the check. So again,
That's
I always
good
say,
advice. Good advice. You have to ask. If you don't ask, you don't know.
and I have a lot of dentist clients, and they tell me the same thing. We'll take cash any day of the week. It's a lot easier than dealing with the insurance companies.
Right.
Katie, hit me with the next one.
My next question is, can you talk a little bit more about health savings accounts and
Yes.
who they apply to? How do you know if you can use one with your plan, and so on?
So a health savings account, think of a medical IRA. You can put away, I don't remember the exact numbers. I want to say about $3,500 for a single person and right around $7,000 for a family. And it's a savings account. You get to deduct it from your tax return, but all those plans are going to have a deductible usually of about $6,000. There's a couple silver plans that have a deductible of about $2,500. You better be a saver and have money put away, because if you decide, Katie, to set up a health savings account and you go with this plan and you got a $6,000 deductible, you've been putting away maybe $100 a month or $300 a month, and all of a sudden 3 months into it, you have this major bill, you're on the hook for the whole part. Now, you will be able to use that money to pay for it and future money to pay for it. So if you could spend the next 5 years replenishing your health savings account and then using that money to pay off a past bill, but the bill must start the day after you set up your health savings account. You can only get a health savings account if your health plan is a health savings account plan. If
Okay.
that makes sense. So it's a certain plan. It's called HDHP, High Deductible Health Plan. It's usually a bronze plan. And if you talk to your agent and talk to them about it, it works for the right person, but you have to be somebody that has the money there. Because once you've been in it 2-3 years and you got money put away religiously, you're great.
Mhm.
There's people out there with $20, $30, $40, $50,000 in their HSA account because they've been putting, $5,000 to $7,000 a year in for years. An HSA is going to work perfect for them. And oh, by the way, an HSA never goes away. With a lot of plans, retirement, IRAs, which I heard just got changed, you got to start taking out by 70 and a half. Well, in HSA, I have money in HSA and I'm going to use it one day when I'm way beyond 65 or 70 and I'll use it then, but it just sits there because I have a really good plan.
Does it turn into an IRA type of situation like I've heard in the past, or does it work that you can still use it from a pre-tax level for medical expenses, even if it's extended into many years in the future?
You can be 90 years old and be using it. So you can extend it. One of my CPA clients said to me that he said to his clients who are pretty well off, fund it, keep all the bills, and then when you turn 65, go back to the HSA company that has the money and start turning it in and taking some of your money back because they added retirement account. It's another option, but by the way, you can use money. What is it? You can use your HSA money to pay your long-term care insurance. It's the only thing that you can use HSA money for insurance, because everybody always asks me, oh, can I pay my premiums? No, you're still going to pay your premiums. However, the reason I'm not a biggest fan as I was years ago is the difference between a HSA plan and a non-HSA plan is not that much anymore. It used to be, when I had one, the difference was like $300 a month. So I'm saving $3,600 a year. So even though I paid $300 to get a physical, when I walk out of the doctor's office, I go, what did I do? But then I realize how much money I'm saving. Now the difference is maybe $20, $30, $50 a month difference. So again, depending on your age and everything, it may or may not work. And if you're a family versus a single person. So
it's important to talk to someone that knows the difference and how it would work for you, for sure.
Yes.
So,
any other questions, Katie?
Just a follow up really quick to that question
Yes.
is, so if you've been working and you have an HSA through your employer and you leave and now you have a different type of plan, can you use that HSA still, even if it's not a high deductible HSA?
When that happens, the first question I ask is, Katie, how much do you have in the HSA? And if you're telling me you got like 5,000, 10,000, I'm going to sell you an HSA plan, because you don't need to get a super rich plan. Because there's no reason to, because that's going to pretty much wipe out your maximum out of pocket, probably. But if you leave that and go to work for another company and they do not offer, hypothetically, an HSA plan, it can just sit there and you can use it for any medical expenses, dental, vision, acupuncture, chiropractic. You can continue to use it, but you cannot contribute to it.
So Craig, I have a question about,
Yes.
because FSA plans were the ones in the past, I believe, that if you didn't use it, you lost it.
Except you can roll over $500, yes.
Okay.
I've never been a big fan of HSAs, because what happens is all my dentist clients get calls in December going, I got to come see you because if I don't use this money, I'm going to lose it.
Yeah.
You really got to place it on how much am I going to spend and all that. I love an HSA account because it's yours always. If you don't use it, you can use it next year. You can max it out. I actually met the guy who actually designed the HSA plan for President Bush and put it together. And he actually showed me a scenario of a couple living together with kids from both sides where they were putting away 20 grand a month. It was a unique situation. Wow. Yeah, it was crazy. But again, who's got that kind of money to do that?
Sure.
But it's a great vehicle to do that. Again, it's only for the person who has the capability of saving money. If you're not a saver, you don't want an HSA plan. And going back, yes, you can use your HSA money in the future, Katie. It's medical, dental, vision, acupuncture, chiropractic, prescriptions, anything like that you can use it for, and you can continue to use it, but you cannot contribute to it. If you start, let's say you call me up today and say, I want to set up an HSA, you can, but you can only put in for this year 1/12 of the money you normally can put in a year, and that'll be for October, November, December. Then next year you can put in all of it, January 1 if you wanted to.
Understood. I have one last question.
Okay.
Something that you've mentioned before, and I thought maybe this is a good place to bring it up again, is hospital insurance.
Okay.
And if that's a good idea, sometimes you see it in group benefits. Do you offer it with a private plan? What are your thoughts?
This is something new that we're seeing, so I'm glad that he's asking that question.
Here's my thought. I only recommend something to you that I have, and we actually have a hospital insurance plan for my office because we put together a plan for the office, and all the employees, most of my employees were born in Kaiser, love Kaiser, and their plan has 1,000 deductible. So we got a hospital plan that would kick in and pay $1,000 if you're in the hospital.
Mm-hmm.
So what it does, it takes care of the deductible. And there's a hospital plan, there's an accident plan, there's also a critical illness plan, and we're going to talk about the three. So with a hospital plan, if you're hospitalized, you're going to do it. If you're in an accident, they will pay if you go to the ER. There's some plans out there that will pay for women to get her yearly woman exam. They will pay for colonoscopy. So you want to look at the plan and see. I like the hospital plan, but again, it only works if it's through your employer. So that's the thing I look at, and we offer to our clients, and it works in the right situation. And it isn't really that expensive. It's probably, I'm guessing, $10, $20 a month for some of these plans. Critical illness is something I really like that I've been a fan of over the last couple of years, because if you have heart attack, stroke, cancer, it's going to kick in and pay you a bunch of money to help you. Because if you're out of work for like 3 months, you may get $30,000 as a benefit for that. So it's a nice way of giving for the employer, providing more benefits for his employees or her employees, but also a way of giving your employees some benefits. Because again, that $1,000 you're getting is tax-free. Now we had a hospital plan in place where my employee, actually my partner, she was pregnant, and we knew she was going to have a C-section. So because she was already pregnant, they wouldn't cover the pregnancy, but they said if for every day she's in the hospital, we'll give her $1,000 a day. So we knew she was going to be in the hospital for a couple of days. So we set it up, we did that, and it was a good situation for that. So they do work as long as you understand exactly how it works and the benefits of it.
I think that's the key. We all need education about what plans, what options are the best options, and it can be overwhelming. And I can't express it enough, Craig, that you've got such a wealth of information and knowledge that it helps everybody that's on this call, but even more people that will hear this as well, because there is such an unknown. We can talk about these things all day long. I don't know how many people want to listen to us all day long, but or evening long. But I'm glad that we have those questions. Katie, are there any other questions, or are we? Because I know we're at time, so I want to make sure we're being respectful of everyone's time.
I think we pretty much covered. I mean, not all of it, of course, but everything I had on my list.
But know one thing that's really important, and that is, pretty much what Elizabeth does all day is help you with your finance and make sure that she looks from the outside looking in, and that's what we do. So that we're looking at your situation and going, I had a client recently that found out that if his wife's going to take Social Security, he's going to go on her Social Security and take half of that. And now they got this money coming in, and even though he's the breadwinner, he's not taking anything out of his, and he just picked up $1,600 a month by being creative of Social Security. So there's a lot of things that are out there that can help you, and the only way to know it is to work with someone like Elizabeth or myself, a professional, who's going to help you and educate you and explain to you all the different avenues to do it. And that's what this conversation was about, So I appreciate
that's really what these fireside chats are all about. The fireside chat is all about just being innovative in a time of, you got to be creative in this world right now, because if you're not, the world's going to just pass you by, and you're going to have a lot of cost, fees, and expenses involved. So, and
it's too late when you're 80 years old to say, boy, I wish I did that.
Yes. And I know we were just talking about my father. He'll be turning 77 here soon. We've got to work on his plan. So that'll be something you and I will be talking about here too.
We're here for you. So if anybody has a question, just please feel free to give me a call, or, send me an email. And, Elizabeth and Katie have my email information. More than happy to. We're just here to help everybody, especially now, because it's so you know, it's so crazy now with COVID. It's like, well, what do I do? The situation, you know, it's different than I've ever seen in my life. So I think
Oh,
it's really
all of
important.
us. I think we can
Yes.
all agree to that.
Yeah.
So Katie, I'll let you do the closing statement, and thank you all for joining us.
Thank you,
Well,
guys.
thank you so much for being with us. If you have any questions, and this is just one piece of a financial plan, so please give us a call. I put our link in the chat to make an appointment so we can talk about your personal situation. Craig's office number is there too if you have specific questions for him. But we'd love to talk to you more and get to know your situation more. So thank you so much for joining us tonight, and have a good night.
Thank you, Katie.
Night.
Thank you, Elizabeth. Bye,
Thank
guys.
you, Craig. Bye-bye.
Bye-bye.
Have a good night.
The information provided in this show is for informational and educational purposes only. This show is not investment advice, nor is it intended to address the financial needs of any particular viewer. The opinions expressed on this show are not intended to be an endorsement of any particular investment strategy or service of any other kind. You must make an independent decision regarding investments or strategies mentioned throughout the show. Before acting on information in this show, you should consider whether it is suitable for your particular situation and strongly consider seeking advice from a financial advisor.